VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
Newly diagnosed patients is an interesting situation. A patient has just been told that they have a disease that can only be controlled, and it could be potentially blinding if they are not careful. So you want to use your drug that you can and make the management for them so that they continue with the care and they don't stop the medications. So by using VYZULTA in these individuals, this one drug gives you dual mechanism and a very good lowering of IOP. And in its early stages, you do not want the glaucoma progressing. So you require robust IOP lowering, and you want to do this with as little medication as possible. So VYZULTA is ideal in this situation rather than actually adding a second medication.
The second would be patients who are change or switches. And what I mean by that is when you add another agent, you increase other variables. Perhaps there's more BAK, perhaps there's other issues on the ocular surface. Maybe the fact that there's less adherence or compliance because there's multiple medications could cause confusion. So a switch is a patient who's, in my opinion, close to target IOP but not quite there. And if you look at some of the research when it comes to VYZULTA, in some of the studies we saw a significantly different lowering effect. So switches are a second group.
So when you're dealing with normal tension glaucoma, we understand that from a pathophysiological perspective, it introduces some additional challenges. But at the end of the day, the only way that we can really protect these individuals is reducing their intraocular pressure. Now, by definition, a normal tension glaucoma patient is an individual who has intraocular pressures within that normal range. And because of that, we have a tighter range of intraocular pressure reduction. So we know that every single point of IOP reduction is more critically important. We want to have the absolute best pressure reduction that we possibly can in the most convenient form possible for that patient.
You know, I think it's tough. When you're in practice, you're in a daily grind, you're worrying about the next patient and everything going on in the healthcare landscape right now to change your practice patterns. It's very, very hard. So when things are working to your best knowledge, you stick with them. And so to really get an adequate feel for what a new tool in the toolbox is going to do for you as it relates to glaucoma, you have to give it a good, honest effort. And to me, I think that means 10 to 15 patients across a spectrum of levels of care. So a few new starts, a few switches, a few patients that maybe have been treated for a number of years. So, you know, I think number one, you have to have a good number. And for me, I'd say around 15, 20 patients is probably a good number. And I would say, again, giving a good spectrum of utilizing the medicine on those patients also.
Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information at VYZULTA.com.